Welcome to Increase to Peace, and today we actually have two different guests and two different topics. Our first guest is going to be Dr. Robert Perrott, who is the most wonderful dentist in the whole world. And so, Dr. Perrott, you've been on the show before, so I'd like to welcome you back.
It's great to be back.
Increase to Peace.
It's been a while. It was fun last time.
I know. I get to get in your face this time
That's
instead of you being in mine.
Payback.
No,
Be careful here.
It is. So you know what? One of the main reasons why I really just want to bring you on is so many people have the fear of a dentist.
Sure.
And you know, what do I do in case of an emergency? And now I'm dealing with taking care of my dad, who is a senior citizen. A lot of things have arisen that I didn't expect to really know what to do.
Sure.
And so let's just kind of enlighten the community today just on just your practice and what you do and how to be able to handle things. So first and foremost, where are you located and how long have you been a dentist?
Sure. We're located at 7200 Bristlewood Drive in Boardman, and we've been at that location 16 years, and I've been in practice here in Mahoning County for 24 years now.
Wow. You
Kind of scary.
only look 25.
Yeah, oh, I love that. It's kind of scary, but yes, time has flown by, but it's been a great ride.
Wow.
The community's been good. It's been a good time.
Wow. Okay, my biggest fear going to the dentist, which I'm sure everybody out there can agree with me,
Yes.
is the pain.
Sure.
You don't want to go to the dentist until you're hurting. How do you get people to come
Well,
in?
it's difficult. We deal with it every day. There's a lot of anxiety and fear, and much of it has come from early experiences. So I think one thing is early on, if you can get your children acclimated before they have a problem, make it kind of a fun educational experience. As time goes on and procedures are needed, we've been using the wand. It's a local anesthetic delivery device. I've been using it since it first
I love it.
was. Yeah,
I love it. Oh, God.
It was first out, probably been about 16, 17 years. There's a very small needle on it. You really can't feel it. It's been a big boon to the practice. If one of them breaks and a patient comes in and doesn't see it in the room, they panic. Where's it at?
Right,
We have multiple ones in the office. But there are so many advances in technology to decrease the pain and the anxiety. Most people are surprised,
Sure.
but it's a deep fear that we deal with every day.
So just to let people know, for those who haven't been to the dentist in
Sure.
a while, the wand is actually how you get the Novocaine.
Yeah, you picture that big silver needle.
It used to
coming
be
at you
huge.
as
It
a
was this
child,
big,
and
they say it's not going to hurt.
Yeah, and it's like, now how do you downplay that?
Sure,
It's
sure.
pretty tough. This literally is a plastic. It's real thin. I mean, everything's disposable, used once. I mean, it's really virtually imperceivable. And we use a topical anesthetic, a gel before we even introduce that. So that there's great caution in trying to keep it pain-free. And be open with your dentist. I mean, if you have a deep anxiety,
Sure.
bring it out there. Don't hide it. The
Sure.
more we know about you, the better we can handle your personal situation and really keep it
Absolutely.
anxiety-free.
Absolutely. And then your staff is so personable.
That's
And
key.
having the TV in the room helps, and you can put on whatever channel you want. So it kind of just
I gotta
soothes you
be
down
honest
some.
with you. These are things that all distract the patient from what's going on. And I am blessed. I am lucky. My staff,
Sure.
I wouldn't be where I am today without them. They
Sure.
are the whole key to the success of the practice. I'll walk in a room and that patient who was just so fearful, was just engaging with the assistant or the hygienist before I get there 10, 15 minutes, and their whole anxiety level has decreased just from the personal interaction. So
Sure.
that's just something. I'm fortunate to have good people around me.
Okay. So just to the basics of it.
Sure.
How many times should a person really brush their teeth? We know the holidays are coming up.
Well,
You're
we
eating
need
all
3
day
to
long.
4 a day, all right? I mean, you've got to brush in the morning and before bed. And before bed is by far the most important, because during the evening, the mouth is closed, it's warm, it's dark, and those bacteria love to multiply. That's their happy time.
Okay.
There. But if you can remove that plaque a couple more times during the day, even with a quick brush at work, that really does help.
Okay. What about flossing? As a little girl growing up, I really didn't know anything about flossing, and then all of a sudden your dentist is yelling at you. What will flossing really help prevent?
It helps, and believe me, my hygienists yell at me too. They're the floss providers there. But I gotta be honest, you have people that'll come in, I'll look at their teeth, they're beautiful. And then we take x-rays, and the reason we take those little bite wing x-rays is to see decay between the teeth. We cannot see it without it, and that we try to educate the patient. That's why we take them. And
Sure.
the floss is what prevents that.
Okay.
Because when you brush, you can't clean where the two teeth touch, and that is where 90% of the decay occurs.
Wow.
So flossing helps with that. And it also helps clean for gum disease too, which is a whole another topic.
Sure.
So it is pretty paramount. There's really no shortcut around it. There's some handy devices that have floss pre-threaded in them that makes it easier.
Sure.
There's some new brushes and techniques we're working with in the office to try to have bristles that get between the teeth better. So, you know, there's some advancements out there we're working with, but it is needed to prevent decay between the teeth.
Why at age 30 do you start to see both male and female start to lose teeth?
Well, the biggest one is gum disease. I mean, gum disease, periodontal disease, pyorrhea, you hear up a whole bunch of different names. That is the biggest cause of tooth loss nowadays. We're pretty good with fighting decay. For the last 2 or 3 years, we have really been proactive of trying to address even early stages of periodontal disease in younger people.
Okay.
Because nip it in the butt in your 30s,
Sure.
you don't lose teeth in your 40s, 50s, and 60s. And we have really put a big emphasis. Some of the brushes and cleaning devices we're now carrying in the office to really address the issues. Antibiotics we're working with to introduce at an early stage to reduce the periodontal disease.
Okay, good deal. This is Andrea Mahone on Increase the Peace, My White TV. When we come back, we're going to find out how to take care of our seniors. Welcome back to Increase the Peace. I'm Andrea Mahone. We're here with Dr. Perrott, and he's given us great information on just good dental hygiene. Now, you know I'm taking care of my dad, and he comes up with this toothache. He doesn't even tell me about it. He's not eating. I don't know why. What are some of the symptoms I need to be looking for, and what kind of complications are going to rise with dealing, especially with high blood pressure and diabetes?
Yes, this has become a big situation. Obviously, with the aging population and all this preventative dental care we've done for so many years now, we have a population with a lot of teeth. And as you become older, you're afflicted with different illnesses, high blood pressure, diabetes, heart problems. Introduces a lot of medications, which make complications with the treatments that we're doing. From a caregiver standpoint, you know, swelling, bleeding, obvious things. Sometimes the senior may not be able to communicate well. Are they eating? Do you notice they're not eating, chewing? Usually that's an indication that there's pain. So the first level is to get them into your dentist or physician, and you know, we can pretty quickly determine if there's any infection involved to get on antibiotics. Then we start looking at the medical history. Diabetes, is the sugar under control? So this thing doesn't get out of hand. Then we look at complications. Does the tooth need root canal? Does it need extracted? Is there gum disease involved? Then, you know, a lot of patients are on blood thinners and things like that to create complications. So sometimes we have to utilize different specialists and things like that.
Yeah.
But there needs to be an increased awareness. We're giving a lot of our senior patients more fluoride, which you think from the standpoint more for children.
Right.
Well, now you have all these teeth with exposed root surfaces, which are a lot more prone to decay.
Okay.
So we're increasing fluoride on these patients to try to maintain these teeth.
Wow. So is there anything in particular that the seniors should be doing that still have their original teeth? Or?
Yeah, brushing, flossing. I wouldn't be opposed to introducing like a fluoride rinse.
Okay.
Act, Fluorguard, or a couple brand names. But
Sure.
you'll if you look in the mouthwash section, you'll see some with fluoride.
Wow.
You got to monitor their brushing or the hands. You know, arthritis becomes an issue.
Sure.
Handling a brush.
Sure.
All these things come into play.
Sure. Or even having a stroke and not even being able to hold
all the
toothbrush the way
time,
you
all
should.
the time. And you know, we've seen excellent caregivers, and we've seen some not as excellent.
Sure.
And, you know, everybody's trying, but it becomes a problem, and as the family members really have to keep an eye on it.
Sure, absolutely. Well, I go from dealing with senior citizens to dealing with kids that are in fights and their teeth are getting knocked out. What do we do in the case of an emergency?
Oh boy, yeah. First thing is get on your phone to your dentist. You know, I have a 24-hour answering services, and most do. And we're pretty good, but there's times, you know, failure in communication.
Sure.
You can always go to an emergency room. You know, when I get a call, I try to ask as many questions. Is it a chip piece, or you see the whole root? You know, and if the whole root's out, that's when you put it in milk or something, and we like to see the patient within a half hour or so to reimplant the tooth.
Sure.
Sometimes they're just displaced. Does the tooth look like it's sticking out, sticking back? You'd be surprised we can snap that tooth back into place. And honestly, we get several of those a year from athletics, you know, horsing around.
Sure.
Wearing mouth guards, Andrea, is big.
Okay.
Not only in football, they have to, but we get a lot of injuries in basketball.
Wow.
A lot. I probably get more basketball injuries than any other sport, believe it or
Wow.
not. You wouldn't think, but
Sure,
we do.
sure.
It's a big physical game now. I know when my son played, I made him wear a mouth guard, and it was in vogue. Everybody was wearing them,
Sure.
and it seemed like if they see an injury, they do it. But a lot of young people, we've reimplanted, some vet implants. I
Wow.
mean, it's
So if a tooth gets knocked out, put it in milk and call emergency
Yeah, if
and
you
get it put back in the next day, hopefully.
well, within an hour or so, if it's in the middle of the night and you can't get your dentist or something like that, get to
Sure.
an emergency room.
Right.
Somebody will get it back in place
Wow.
there.
That's really good to know.
Yeah,
That
and
is.
it works. It works.
So what are some of the other new things that you guys got out
Oh,
there?
that's what keeps us excited.
Yeah.
There's always new advances. Probably the newest thing we've been doing for about 2 years now. It's a CAD/CAM system for doing porcelain crowns. Traditionally, if you needed to cap on a tooth, you come in for an appointment, we prepare the tooth, take impressions and molds, and a laboratory would make it. You can come back in a couple weeks and have them put in. Now we have a system, it's actually made in America, in Richardson, Texas, down outside of Dallas, where we prepare the tooth. We have a laser scanner that scans the preparation and the surrounding teeth.
Okay.
The model is built three-dimensionally on a computer screen, right chair side. You
Okay.
can watch me do it.
Wow.
And we design the crown right there in front of you. And then we have a milling machine that makes the crown of a block of porcelain. We fit it
Wow.
in, fire it, glaze it, put it in all in one appointment. And
Wow.
it may not sound big, but it is. If you've gone through the
Yeah.
process several times, the change has been well received. I can make adjustments and corrections right on the computer screen as I'm going with the patient right there. And it's really, really an up-and-coming field.
And so is it pretty much the same cost as it was before?
Yeah, the crown's the same. I mean, the
Okay.
end result is the same. The crown's the same. It's more efficient for the patient because you're making one visit to the office.
Right.
I like it because the more I work with it, I'm in more control of every little parameter instead of taking a model, sending to a laboratory, and having somebody else try and discern, what
Wow.
we're trying to do. We've done over 500 units in the 2 years now, and it's really, really exciting. And that's kind of the cutting edge thing going on right now.
Wow. Wow. So I guess my final question would be, in just the 30 seconds before we go
Sure.
on commercial break, is if someone has missing teeth, how important is it to get it replaced, or is it okay to just kind of go?
I had this conversation yesterday with a lady, and she was missing some teeth, and I could already see her top teeth dropping down into the space. In another area, the teeth are tilting, and we were discussing partials and implants and things like that. And I said, what we have to do first, we have to do some orthodontic work to get the opposing teeth realigned. And she says, oh my goodness, I didn't realize
So you need to
that."
replace missing teeth so that they all
to
line
hold
up.
the position so they all stay lined up
Oh.
together. Yes.
Well, there you
yes.
go. You heard it here on Increase the Peace. Andrew Mahone, just trying to keep your smile pretty. We'll be right back with a new guest.